Welcome to our channel. For today we have chosen a case of ophthalmology decided by Supreme Court of India on 19th December 2024. The case centers around a cataract surgery performed on a patient in Pune in 1999. The patient had developed cataract in his right eye and underwent surgery in the month of January. But the next day itself, he began experiencing pain in the operated eye with headaches. Despite 5 visits to the same surgeon, the patient was repeatedly reassured that the operation had been successful and he will have a normal vision. On 27th January, the patient could not see anything from the operated eye and sought a second as well as third opinion. All the doctors found that patient's eye had been severely infected, leading to diagnosis of endophthalmitis. Ultimately, patient had to undergo evisceration procedure at military hospital, preserving the eye only for cosmetic purposes. Aggrieved by the loss of his eye, the patient filed a medical negligence claim in year 2000, seeking compensation for the permanent loss of vision. However, the District Consumer Forum dismissed his case in year 2005, citing a lack of expert evidence. In the following years, the patient appealed the decision to State Consumer Commission with an expert opinion. The State Commission observed that operating doctor filed medical records only in the appeal stage, that is, after 4 years of filing his initial reply. Using the discharge summary from military hospital for diagnosis of endophthalmitis and medical literature from the reference book Basic Ophthalmology, the State Commission found doctor to be negligent and awarded a compensation of Rs 3.5 lakh to the patient. Both the patient and doctor moved to NCDRC, that is National Consumer Disputes Redressal Commission. The National Commission noted that patient approached the operating doctor with a new dressing on 23rd January, which was not put when the patient was sent back on 20th January. The patient could not explain when and from where he had applied the new dressing, concluding that patient must have changed the dressing of the operated eye at his home of his own, in turn causing displacement of lens and infection. Hence, the development of endophthalmitis was attributed to trauma without any fault or deficiency on the part of doctor. The NCDRC dismissed the patient's appeal. Now the patient filed an appeal in the Supreme Court. Supreme Court gave its final judgment in the month of December 2024. The court observed that the surgeon had failed to detect the infection despite multiple visits. It was also noted that the prescription slip of 23rd January makes no specific mention of any trauma, which weakened the NCDRC's argument regarding patient's role in causing the infection. The court concluded from the opinion of eye specialist that it was apparent that patient suffered from endophthalmitis from contaminated instruments and ordered the surgeon to pay Rs 3.5 lakh in compensation within 2 months. From this case, there are few key takeaways. Provide case papers. In this case, treatment records were not submitted by the doctor till 4 years after his initial reply. This point was noted and made specific mention of by State Commission. Documentation is primary. In case of any suspicion of trauma, documentation is a must. Corroboration of written version with documented findings. Here there was a mismatch between the documents and written version filed by the doctors. A contradiction of such nature raises question on credibility of practitioner's version. Contributory negligence of patient can be a defense. However, in this case, the doctor failed to prove the same. Lastly, the doctor failed to diagnose the infection despite multiple visits, which ultimately led to eye loss. Here, the last clear chance doctrine also went against the doctor. That's all for today's video. If you found this video informative, kindly like, share, and subscribe to our channel for more insights on medico-legal matters. And as always, leave your comments and questions below. We would love to hear from you. Stay informed, stay safe.